Thank you so much, Kelly. What a privilege. I'm still overwhelmed at the questions here, Kelly. You know, we had another 20 or so come in. I think we're close to 60 at this point. But, you know, it's relevant that I mention one more question as I start this part, Kelly, because a few people actually have asked, is there anything I can do to lower my M spike or my monoclonal protein? And so when you look at the title here, M-Power Charlotte, the M doesn't stand for myeloma protein, it just stands for myeloma. But this is part of what we're trying to do, is to empower people. To be very specific, there's nothing explicitly that we can do per se that will change the course of myeloma in an individual person by dietary means or other, but a healthy lifestyle, adhering to the treatment regimen that you have clearly can have an impact. You know, Pete showed us some of those amazing curves and amazing studies that when people got into that deep remission, that they could stay there. And so hopefully part of our concept today is to empower you as an individual to take control and charge of your myeloma, but also as a community together for us to what we're calling change the course of myeloma. So what do we mean by that? So at the IMF, we have an empowerment mission, which is advancing early and equitable access to myeloma information, screening, and treatment in vulnerable communities worldwide. So this is a broad objective. Obviously, today we're focusing primarily within the African American community in the Charlotte region, but we know that there are a lot of individuals who suffer with this disease in many ways. And so we want to help in every and any way possible. But specifically, we've come up with this title of M-Power Charlotte. The M, as I said, referring to myeloma, and recognizing that we have power within ourselves and we want to feel empowered. I think part of the challenge in cancer is people feel unempowered. They feel, well, as we're going to hear from Tiffany in particular later, they feel like, well, I guess I just do whatever the doctor tells me to do. And as I said, that's not the attitude that we want to take. I love the notion that I partner together with my patient against this disease. And so we hope today that we're going to show you a few ways in which that empowerment can happen. You know, our initiative, as I've mentioned, is really the African American initiative is one of the important parts of our overall empowerment mission. Now, a lot of people have tried to do this and to change this course of myeloma. And we know that it's not going to happen overnight. We know it's not going to happen with one initiative, but it is going to happen as we all work together. And I think the IMF is uniquely poised to help with this mission because we have this history of this fourfold plan, as you can see here, and the pillars of myeloma, of support, of research, of awareness and education, awareness and advocacy. And so as we do that, we think it's going to be very helpful, not just in the Charlotte region, but hopefully in many other regions of the country that we're working on. And our core initiative, as I briefly indicated before, is to improve both the short and long-term outcomes of African American patients through three primary ways. Number one, engagement of the community, and that's much of what we've been doing here during Myeloma Action Month. You may have been seeing all sorts of different motifs and different things in social media and other places that we engage the community. This is not a disease that isolates an individual. We pray it never isolates an individual, that it brings the community together around that individual. And so we know the community is inherent in changing the course of myeloma. Secondly, in education, I'm going to share with you quickly how we're working and educating not just all of us here on the workshop today with so many people that have joined us, but also directly to the primary care providers, especially in regions where there are a lot of African American patients who may not realize the increased risk that exists for African American patients who may have multiple myeloma. And then, of course, throughout the whole time, supporting patients as we've been doing at the IMF for 30 years and working together with amazing groups of individuals like the folks at Atrium Health who've just been marvelous collaborators through this. And as you've seen today from Pete Voorhees at the Levine Cancer Institute, part of Atrium Health, and as you'll hear shortly from Manisha Bhutani, two wonderful physicians who have dedicated so much of their life to this program. So these three pillars of community engagement, education of the primary care community, and support of patients have been important. In addition, in Charlotte, we are going to be including a screening study to help understand this disease better and follow patients more closely who may have this pre-myeloma condition. But I'm not going to say much more about that because I don't want to steal the thunder from Dr. Bhutani, who's going to share that with us in a couple of minutes. Why did we choose Charlotte? Well, we chose Charlotte initially, and we're planning many other places, but we've chosen Charlotte because over a third of the population is African American. There's a world-class myeloma center there in the Levine Cancer Institute, and really an extraordinary integrated primary care network. You know, myeloma is not just a disease that is seen by myeloma specialists like myself and Dr. Voorhees and Dr. Bhutani and Amy Pierre, whom we've seen today, but also really begins at the level of the primary care doctor. And so we felt that that was an ideal place to do this. And so we hope that we can have an impact here and then have a further impact in many other places. So we've created a website, and I'm not going to walk you through it in detail, but it's m-powercharlotte.myeloma.org. You could even access it through the myeloma.org website, which is our IMF website. And I've just shown you a few screenshots here of the actual website. Not that you need to see my face anymore. I'm sorry, you've seen enough of it today. But we see these different screenshots of areas. And the centerpiece of the website is this toolkit. This is the toolkit that can help you learn more about myeloma. We've created a few very simple videos. Obviously today in the workshop, I tried to provide some highlights to you, but we can learn more about myeloma, understand the signs and symptoms of myeloma, and indeed find a support group. The IMF, we have over 160 support groups across this country, led marvelously by Robin Toohey and her amazing team. And so we want to provide support and help on the front lines, people who are going through what you're going through, people who can provide education, who can provide information and support to you as we go through. There are resources there that can help caregivers. For many going through myeloma, thankfully, they're not going through it alone. Their families are a huge part of this, and their caregivers, those that are helping them through this journey. And then, of course, we all know navigating the healthcare system in this country can be really challenging. And so we've tried to provide some help with respect to drug reimbursement, information assistance. The toolkit is chock full of things that we really feel can help you directly, and indeed backed up by some marvelous stories and marvelous insights into this disease. And here's a picture, of course, of Tiffany, who you're going to see shortly, who shares some of what her experience has been. So you can know that you're not alone in this and that there are others who are there to help you. And lastly, that there are other ways of accessing us. We've mentioned the websites, but we have this, the info line that's there, 800-452-CURE, and also directly in your region, as we expect the majority of you today are in the Charlotte region, that you can reach out to Atrium Health through their website or through their phone number, as you see here. So we're very excited about this initiative of M-Power Charlotte. We really believe that it is going to help us change this course of myeloma. I hope that I showed to you in my first talk today that the current course of myeloma is not acceptable, that this disease sadly takes longer to diagnose, is not optimally treated, and has resulted in poorer survival in African American patients. We want to change that. We want to speed up the diagnosis and make it more accurately. We want to make sure that African American patients and every patient in this country have access to transplants, to triplets, to clinical trials as we've described. And most importantly, we want to change the course of myeloma so that we can see that the improved survival that we're excited about in myeloma can be had by every patient, that there should not be this disparity that unfortunately we see at this point. And we're very committed to this, and we're committed to this in the long term. And we hope in every way to be able to help everyone with myeloma to achieve that. So Kelly, with that, I am going to stop and turn it back to you to bring to us Dr. Bhutani to share with us the great work that she's doing and her team there.